To further discuss this, I'm joined by Medical Director, Dove Hospital, Dr. Philip Oragui. Thank you very much for joining us. High blood sugar is commonly linked to diabetes, even though that report has showed us it's more than that. Please explain, what really is diabetes and what are the causes?
Thank you for having me. Diabetes can be described as a syndrome where a patient has a high level of blood sugar. The usual level of blood sugar is between 70 milligram per DL to less than 100 in a normal person. That's fasting blood sugar. However, you find that in a diabetic, they have greater than 127 milligrams per DL as their fasting blood sugar. And you've also find out that when postprandial, that's after meal, their blood sugar, 2 hours after meal, their blood sugar is still struggling to settle down. And some of them, even during fasting, without meal, they go into catabolic state and their blood sugar continue to go up. So diabetes, this is just looking at the sugar alone. But we know that diabetes is much more than that. Diabetes is actually a syndrome. So looking at sugar alone is just looking at one of the parameters. There are other underground currents going on that complicate diabetes. For instance, the other doctor that spoke previously talking about trans fat and saturated fat. You find that in people, the diet is so, in Africa, particularly in Nigeria that we are located in, we eat a lot of carbohydrate, and these foods are converted to um, as to fat and stored as such, and find out that plenty of us have dyslipidemia. Dyslipidemia is a state where a patient has a high level of circulating lipids in the blood. So, and there are about four major, let me put them five, the cholesterol, the triglyceride, the high density lipoprotein, the low density lipoprotein, and the very low density lipoprotein. Of all these five, it's only the high density lipoprotein that we expect that a rise in high density lipoprotein is positive, but for the other ones, we want them to be low. And if a patient, if someone maintains high density high lipid profile for a long time, sometimes up to 10 years, they're definitely going to become diabetic down the line.
Okay. I think the network has stopped you, but what would be lifestyle changes you will suggest for people to make in order for them to lower their chances of getting diabetes?
Thank you. First of all, first thing first, we must reconsider our diets. We have a lot of vegetables and a lot of natural food in the environment, but the advent of the Anglicanization of Nigerian food is a factor that is not always positive, but we have bought into it. So processed food is one of the problems that we have. Eating carelessly, the food should be eaten, uh, spaced out, not all the time you eat this, you eat snacks, you do that, you do that. And then sedentary lifestyle. For instance, those that work in offices, they should have a routine. Some companies should have a routine when their staff should be allowed to exercise themselves. And even if for those who work, you should create a time for you to do exercise at home, time to take a walk, time to maybe probably go to gym if you can, but if you cannot, take a walk, do some personal exercises. I think the problem with plenty of Nigerians is obesity, because of eating and not exercising. And also the quality of what we eat. We eat a lot of processed food. we have left our usual African diet, and we're now eating processed food. And
All
some of
right.
these processed food have high glycemic index.
All right, doctor. In interest of time, quickly, how accessible is diabetes care in Nigeria, particularly?
Diabetes care in accessibility to care depends on geography because Nigeria is still a developing country. So if someone is in the city, access to care is available. But if someone is in the rural area, access to care is almost non-available, or where it's available, ignorance doesn't allow people to access this care. Again, the issue of religion or religionizing health. You find people who are sick and they're telling you that somebody poisoned them. There was sometime in the past, somebody said there was a popular Nollywood actor who was sick, and then what I heard, as for one, is that he was poisoned. But down the line, we later realized that he wasn't poisoned; it was diabetes. And then you find I'm just coming from my village just a couple of days ago, and then I find people who died of diabetes, and people are saying, oh, they were poisoned, that they were given some charms, and then their legs and part of their body start decaying. That's just diabetic food. So if someone is in the rural area, diagnosis and the care is a bit difficult because hospitals are far in between. And again, even when you find some of those hospitals, it's just a mere glorified a chemist shop
How
because
can we
sometimes they don't
improve
have the
on that,
diagnosis
sir? In 30 seconds,
kits.
if you can, how can we improve on that so that the care can get to people even in the rural community? What must government do? As quickly as you can, please.
Government should build more primary health centers in all the villages, in all the rural areas. And then government should equip these primary health care centers. Government should make sure that at least a qualified lab technician is posted to each primary health centers. I know of my state, there is no qualified technician in the primary health centers. And some of the states, you find that they just employ one staff. And then this same staff, who probably may be a nurse or a CHU or a midwife, is the one running the show, doing everything. It's not possible. It can't work.
All right,
So
doctor.
equipment is important, and the staffing personnel is also imperative.
That is as well a challenge because we know young people would want to go where they will have more opportunities. But I mean, it's something we have to deal with eventually. Thank you very much, doctor, for speaking with us.
Thank you.